The focus from the beginning has been ease of use for the patient, and the big step forward has been the factory calibration of the device. So the sensor does not require calibration of the finger sticks, they just simply place it. It's a very easy to use inserter, it's a one-step process of putting it on. And then they're able to check the glucose without doing routine finger sticks. So that's, I think, a first step in terms of the hassle factor of just getting the system to work. And then simply by having it work wirelessly with a quick scan, and they're very discreet, it can be very quick, and they're able to get that information they need in terms of the current glucose, the trend that they're going, and also the recent 8-hour history. I think that's been the big focus, is how do we make it quick and easy for the patient, and with some level of discretion that they're able to manage. And that's why we think we see some of these, good adoptions, frequent use of the system. And then the cost has also been a continuous focus for us in terms of how do we make, it perform at the level that patients need, but also at a price that is reasonable. And so that's been an ongoing focus for us. The Freestyle Libre reader stores 90 days of memory, so when they go to the clinician, or even from home, they can use our cloud-based reporting software, upload the data, and then there are a number of reports, but the quick summary reports do show very important things about what's the average, what's the variability, what's the pattern over the day, so you get that full glycemic picture to make the focus on what is the primary issue to address. And then there's also summaries of how often are the scans being done, checking the glucose, how often is that done, when are they being done during the day. And so it focuses the discussion really quickly on what's important for that patient. And so I think there has been really strong adoption of that. There's been a lot of nice case studies shared at our symposium from Earl Hirsch and Kurt Midyett with their experience with it. And that, the discussion between the patient and clinician gets directed really quickly depending on what the data show. And if it is a question of you're not checking often enough, that should be something we should focus on. That becomes a discussion. Or it might be a discussion around hypoglycemia, or maybe it's a discussion about high glucose levels. And so it's really enriched. They've been telling us the discussion of what they're able to talk about. We do try to be as clear as possible. I think the meta-analysis is very much in line with what people would expect in terms of collecting a lot of studies and getting that overall impact analyzed. I think from the real-world data, we've I do want to emphasize that people are using it. They're checking the glucose a lot. That is normal with what we're seeing. On average, people are checking 13 times per day, and let's say 50% of all people are somewhere between 8 and 17 per day. So that's like a typical use, and so that's, I think, something to consider when people are seeing it on a personal basis.